Hi guys, so today we're going to look at the digestive system anatomy, part 6. This time will be the liver. So the liver is actually located in the right upper quadrant of our abdomen, and the function of the liver is actually to produce bile, but it also amplifies it. So when I say amplify, I mean it breaks down large chunks of fat into small droplets, and those small droplets will actually increase the surface area, allowing for the enzymes to break them down even faster. Now, the liver has over 200 plus functions, but I'm going to name some. So, it has functions such as cholesterol metabolism, the urea cycle, blood detoxification, clotting factors, and protein synthesis too. Now the liver is split up into four lobes. Sorry, you actually can see the left lobe, the right lobe, the quadrate lobe, and the caudate lobe. And between or beside the caudate lobe, you actually can see the groove of the infernal vena cava. Above it would be actually the portal triad, and further above the portal triad would be the faxiform ligament. Now, what is the portal triad? Now, the portal triad, right, actually consists of the proper hepatic artery. Now, the branches of the hepatic artery is actually going to course from the celiac trunk itself, and the celiac trunk is going to form the common hepatic artery, and the common hepatic artery is going to split into the proper hepatic artery. And the portal vein, right, is actually coming off from the infernal vena cava itself. And what happens is it's going to split into two other veins called the superior mesipic vein and the splenic vein. And ultimately, all of these deoxygenated blood, right, will be drained from the GI tract through the portal vein. It'll go through a bunch of veins, then leading into the infernal vena cava. It doesn't directly drain into the infernal vena cava. And we have the common bile duct. So you can see the left and right hepatic duct down here, and those ducts are going to form the common hepatic duct. And the common hepatic duct comes with the celiac duct to form the common bile duct. And this is where bile is going to flow down into the small intestine through the major duodenal pablida into the helping with the amplification and digestion of nutrients. And see here, we actually have the portal triad. So the portal triad, right, is actually going to be forming the lesser momentum. So the lesser momentum originates from the lesser curvature of the stomach and the first part of the duodenum itself, and it's going to be splitting into two ligaments down here. First, you have the hepatoduodenal ligament and the hepatogastric ligament. So the hepatogastric ligament, not sorry, the hepatoduodenal ligament is actually going to form your portal triad itself. Now you can see here on the liver H and E stain, what happens, you can see all of this you're actually seeing down here is the portal triad. And on the portal triad, you can see the portal vein here. This will be the hepatic artery, and this would be the hepatic duct itself. Now, the liver is actually covered by two layers itself. First, you have the parietal peritoneum and the visceral peritoneum. Now, the problem is the liver has this bare area. Now, this bare area actually isn't covered by either one of those two layers, nor the parietal peritoneum or the visceral peritoneum itself. Now, this happens because it's just a natural structure formed in the liver itself. And what happens is that if you develop a condition known as ascites, right, what happens is that basically there is going to be a buildup of abdomen pressure inside the abdomen, and this causes the abdomen fluids, right, to actually push up into the bare area of the liver, and those fluids will actually go into the pleural cavity of the lungs, and now you have a hepatic hydrothorax inside the lungs itself. Now, this is a better view of the bare area of the liver. You can see how there's just an opening there, and it's not covered by either the visceral peritoneum or parietal peritoneum itself. So it's just an exposed area of the liver. Now, the you can see here, right? This would be the faxiform ligament on top of the liver, and further down you can see the ligamentar trias. Now, The falciform ligament, right, is going to attach to the liver at the anterior abdomen wall. It's going to attach the liver at the abdomen wall itself. And drooping down further, you actually can see the ligament of Trias. And the ligament of Trias is actually going to hold the remaining of the fetal umbilical vein itself. And this will be a better view. You can see it down here. This will be the falciform ligament, and this will be the ligament of Trias down here. So that is all for the liver. I hope you have enjoyed this video. Thank you so much for watching, and I highly check you out the new series that I have started of the digestive system. Go and check out part 1, part 2, part 3, part 4, and part 5. So if you're checking out this video, thank you so much, and I'll see you in the next video. Peace.